what made me want to talk to Lawrence, given that you've never really heard my story in depth, you didn't hear bits and pieces of it, but the particular piece as you wanted to hear my experience as a woman living with and me sharing my experiences at trying to get different services and care, but also get a chance to share my story in detail and get more personal and more intimate with you. Absolutely. And know you a little bit more better outside of
the work.
And I think this is awesome that you have the opportunity to put a collective together of different people's experiences that are people living with HIV. But I think Black women, we also get put on the back burner on a lot of things. And I wanted to share that piece, but also bring awareness that we are here. Yeah. I want to let women know that there are things out there that can protect them, such as PrEP, which women don't know or access the service or even know how to have those conversations with their provider because certain perceptions or biases, I'm not even going to use the quotes with the biases because we know it's there.
Absolutely.
But on how they perceive the people. But
well, you talked about messaging earlier. Let's dive a little bit into that. What messaging was out there for you that was not inclusive? Like what were you saying?
So
and what needs to change?
Okay. So when it comes to media, things that you see on TV, growing up there was this commercial that used to play, and I'm about to out-age myself right here. So it was this commercial where one person would be sitting in the theater. And next thing you know, they talking about how the people that you slept with also has 10 other people. And as they're showing this graphic about this, the room is getting bigger and bigger and bigger with more people, more crowded. So I'm like, but I still didn't see myself in that messaging because at that time, people only still think HIV is a gay white man's disease. And that's what was primarily in the commercial that I would see on TV. Mm-hmm. You know, white gay men or white women. There were no Black women being inclusive of a messaging. But then again, we did have certain shows such as A Different World. They would touch on these topics slightly, but not too direct or too clear. But you have to read the underlying toning in the message. So if you're not picking up on the language that's being spoken, you won't be able to connect. They're talking about HIV or they're talking about sex. Because they was like, you got that sickness, or you got the news, and that was the way it was framed on TV, I guess, because of, how can I put it? Censorship, so to speak. Mm-hmm. Yeah. Or what things can be talked about on TV, and is the bigger mass audience ready to hear these conversations? Mm-hmm. So things like that, family. It wasn't talked about in the family. Mm-hmm. Sex is a taboo topic in the family. I won't say in Black families, in all families, it's a taboo topic. But, we given what we see. You're taught birds and the bees, books for boys.
Yeah.
So
when you were diagnosed and you needed medical attention, who was there to support you?
I was, from day of diagnosis, my twin sister was with me.
Oh, you have a twin sister?
Yes, I do. I have a twin sister.
Okay.
That I could include in the beginning of who I am. Yes.
It's okay.
I'm a twin.
You're a twin.
Yes,
wow.
But my twin sister was with me at the day of diagnosis. I got a call in about that afternoon, somewhere between 12 and 3 o'clock p.m. Hey, we need you to come back up here. We've been trying to reach you. Cell phones was out, but I didn't believe in carrying a cell phone back then. So, they ended up calling my job to contact me because that was the only working number that was on file in the event. So they called my job and was like, hey, we need you to come up here to get your results. They're back. I already knew from there it wasn't good.
Yeah.
So I was like, okay. So when my sister went the following day, she told me about an experience when I shared the recap with her. She was like, all I remember you screaming. Mm. I don't even remember me screaming. Mm-hmm. She was like, because they wouldn't allow her to go in with me.
Yeah.
So I was like, she can go in. This is my twin sister. I trust her, she's my support system. Mm-hmm. But the facility I was at wouldn't allow that to happen. So she got to sit outside. I'm in there. The doctor was like, you're pausing pregnant. and walked out the door. In between him walking out the door and him delivering the news and walking out the door, this is when my twin sister tell me all she remembers hearing a big curdling scream. She was like, you screamed for about a good 2 minutes.
Wow.
I was like, I guess I blocked that piece out because I don't even remember that. So once that piece, he was like, your pa's pregnant. They gave me a folder of a list of different clinics. There was no soft handoff or anything. Bedside manner was just, if they was going by rating, they got an F++.
Not bad.
So, and from there, that was really my driving force to, where's the conversations at? Where are the women at? Because I know I'm not alone, but then again, I felt alone. But to have to research and find a doctor, case management services, I had to do all of this on my own. So I had to make these calls. The provider, they didn't even have a patient advocate at that time at the clinic to walk me through this. And this is a federally funded clinic and located in Detroit to do all services and plus what they would call wraparound services, but there was no case management in there or a patient advocate in there. So I left home. The good thing, it was not on a Friday when I got the news. It was not on a Friday. It was in the middle of the week. I would say it was a hump day Wednesday, matter of fact. It was a hump day Wednesday. And that day of September 14th was the day that changed my life.
How's the baby turn out?
Oh, so right now Anastasia she will be 19 next month.
All right.
She's HIV negative, and she is now a mother herself.
You're a grandmother.
I'm a grandmother, yes,
Well,
twice over.
congratulations.
And she is now the current face, you would say, for the Detroit at Rise program, for this program that's offered through the City of Detroit Health Department, to where it helps moms stay in care, get back and forth to the doctor, and even offers program to Rise to those who are the father of the kid or the baby, or any caregiver. So to make their appointments for the first year and then the year after birth.
Awesome.
Yep.
So being a woman living with HIV, newly diagnosed and newly pregnant at the time, right?
Mm-hmm.
How was your journey through your maternal health care?
I was saying, at first I was going to say I was going to terminate the pregnancy.
Okay.
Which brings you back to your point of media and how it was perceived, because watching stories as a kid, all black families, we watched the soap operas. Well, parents watched the soap operas. And one particular summer, I was on punishment, so I got stuck watching General Hospital with my mom.
Okay.
And at the time, Robin Scorpio, who was on there, she was pregnant and living with HIV. She was living with HIV, and she was pregnant due to behind a rape. So she was the only person I saw that was pregnant with HIV. I didn't even see no black women, but you got this white woman on the soap. I was like, no. Then Ryan White stuck out to me, given the way he was treated. I was like, nope, terminate the pregnancy. But when I met Dr. Theodore Jones, he changed all of that.
What did he do?
He educated me more.
Okay.
I would say he has a direct but welcoming tone and approach to his delivery. And once he walked me through the next 7 months, I was good care team, and that's when they really had programs for women living with HIV, especially the support system, because when most women are diagnosed nowadays, they find out via pregnancy, especially those who that don't have the adequate health care or access to health care. Majority of women find out during pregnancy.
So did you face any type of discrimination when you were looking on like maternal needs, or even in terminating or keeping the pregnancy?
No, that was not, I would say, that wasn't until year before last. throughout my maternal health, I had a wonderful experience. I was never discriminated with, even when I went to the hospital with other health issues on hand. Never experienced that, discrimination, stigma, none of that. Because it happens.
Yes.
But 20 few years ago, found myself pregnant. We all get down dirty. But it was with this guy. I thought it was going to be different. And he's a person living with. So I was like, okay, cool. I can see myself. And I guess, I don't know, the maternal clock with the biological clock was kicking in and all. Again, I was like, I don't understand why, because here I am, 40-something years old, and I'm thinking about having another baby. No. But things to where God puts you where He wants you to be. And I had found out I was pregnant, took a press test, confirmed it, and I was like, And when I told the guy, it went straight left.
Wow.
From there, gave me confirmation, no more babies. So when I went to go seek reproductive assistance to terminate the pregnancy, I went to this one place and get all the way in the back, fully undressed in my robe and everything. I already knew how far along I was, so the normal procedure would be the vacuum procedure. So you wouldn't even have to do that. You could just gave me the pill and went about your way.
Mm-hmm.
So no, I read mine to give you that checklist. When you're checking in, all your health questionnaire and stuff like that. So to get to that part where it says, any other ailments or any health issues, stuff like that. So I checked in HIV, and then it was like, well, do you take your medicine, things like that? I said no, but everything is undetectable. They were not educated on that.
Wow.
So the nurse that the MA that was taking care of me was registering me, into the system. She was like, 1 second, ma'am, I gotta go speak with the doctor. So when she did that, she left, came back about a good 3 minutes later, and was like, no, we can't perform this, the services. I'm like, why not? She was like, I don't know how to say. I already knew what it was when she walked out the room. I just need her to verbalize it. But she's never been put in this situation, to my knowledge, because she don't need to know the language to use to even, skate by with a possible discrimination suit.
Right.
So I was like, go get the doctor, bring her in. At this time, I didn't call my clinic where I go receive my care, call my patient advocate there, had her speak with the doctor, everything, and they still would not do it. Mind you, I had already paid my money to get the services done. They gave me my money back, said we can't do this, and then it was uphill from there. So from that point, a good friend, a good fellow advocate of mine, took it upon herself and made some noise and made some ruckus. She did a couple of Facebook Lives calling them out, which I love her for that. And she's also spoke on this incident with other people that I was unaware of, but on a good note, not doing nothing maliciously, but making them aware. Since they have this, the option to have people go out, professionals to go out and connect with these facilities that do stuff like that. And as a result of her informing them of that, they was able to get a physician detailer out there, which is a person who goes out and educates certain facilities on the different laws surrounding HIV, how to treat people in the event of you have to encounter someone living with HIV, give just the whole spiel. And they have now changed some policies.
Awesome. So, that's a lot to take in. Wow. I'm just like, oh my gosh, let that marinate for a minute.
Also, I filed a civil rights discrimination lawsuit.
Okay.
And that didn't go too well.
Why?
Even though I contacted them and gave them detailed account, everything.
Mm-hmm.
But because they fired the nurse, the MA, before he could finish his investigation, because it took like 7 months all because they couldn't get in contact with this MA. Come to find out, they fired her. And because she couldn't corroborate what I experienced.
Yeah.
Even though it's detailed account, but...
Yeah. But you were able to get the care that you needed eventually.
Yeah, eventually I went across the street.
Across the street?
Because that's how close Because that's how close they are. If you know City of Detroit, you know the exact two that I'm talking about. Located on the east side of Detroit. So, one sits here, and the one that discriminated against me sits here, and the other one that accepted me is like adjacent and on the other side. But what it taught me in that experience is you have to really document your visits.
Yeah.
I mean, I'm out here taking pictures. I'm like, damn, you won't get me this time.
Yeah.
Slightly doing like this. And when I went to that facility, they was like, they could have just gave you the pill.
Yeah.
And let you do what you do at home. Let it, whatever it was going to do, and you could have been at home, and all of that could have been avoided.
Yeah. So your status, you had mentioned that you were not on medication, however, you were still undetectable. What is that considered?
Oh, I would say, for me, my undetectableness, in education, you have to be, your viral load, which is the amount of virus of HIV in your blood, so low that it cannot be detected on a normal test. And that has to be for a certain amount of time before you can be undetectable and virally suppressed. So with me, I was saying, given that I've been undetectable since my viral load has been under what they call 14 copies since day of diagnosis, because I had one incident where Dr. Cone, he didn't know if they mistaken my taste, mistakenly diagnosed me. So I had to do that process all over again because he could not find the actual confirmatory of my first test. So, but they ended up finding it was Viiv. They dealt way somewhere. But they was able to find it. But in that meantime, I went through the whole process of testing me because my viral load had never bleeped. From 2006, 5 is when I was diagnosed. When this issue was brought up, it was around, this experience was around 2008, 9, somewhere around there. He was like, we're going to have to retest you. Whoa. What you mean? You're just a unique case, Shanika. You're just very unique. We would expect your viral load to go up somehow, but your viral load has maintained under 14 since 2005. And you should have bleeped somewhere, but I've never bleeped over 14 copies. That's how they record it. And from there, I was as what they call a long-term non-progressor. Okay. That's what they call people that where the virus does not grow in your body. That's the way easiest way I can put it. If it, does not, spread through your body. And as of now, being a part of different studies with the NIH, that particular study, that's no longer funded. Oh. Man. So they take people living with, that are considered long-term non-progressors and see what it is in our genetic makeup to see what it is about our bodies that's able to suppress it on its own without the assistance of medication. Now from there, you can be classified as an elite controller. And that's where I fall in the category of elite controllers. That has been, as of since 2009, from now to now. Okay. So with the now one, like I said, my body's, I don't question it. This guy's make, his favor. I'm able to live and thrive and not have to, I have the luxury. Absolutely. And the privilege to understand that I don't have to take medicine. So I have to be careful with my messaging and how I deliver that story because I never want to give the people the impression that maybe I can do this. No, I go twice a year and I've been part of a study.
Exactly.
But, everybody's different, living with HIV. And that's the unique thing about this population. Everybody's case will be different. And it's like, for me, it's 1 for every 100,000 people. So I'm a special person. My birthday is 11/11. So that's how I got to start looking at things.
So that was the whole issue, was that their lack of understanding that you were an elite controller. So do you see the messaging changing now regarding women or even elite controllers as far as the HIV messaging?
I see the messaging changing as far as women, but I think the caveat of that piece is having Black relatable women. Because they look at us, we're all different shades, all different walks of life. So I would like to see urban women being, doing the presentation, programming, or be part of the messaging. Hey, if you take PrEP, and that's why I love certain young women that are currently active in the Michigan PrEP campaign right now, Black cis women that are actively in the campaign, because they are relatable women. So I see that messaging changing right now and bringing awareness to that. Because as of right now, when I was in grad school, I did a particular study, a capstone, and it was able to identify certain information where it was only on a college campus, 11% of Black women that attended this campus were provided access to PrEP. 62% of this college women didn't know or were unaware of PrEP at a different college.
Wow.
So we still see that more education is needed about PrEP.
Yeah.
But thing is, a lot of people still think it's a gay white man's disease. How, I don't know. Yeah. Or gay man's disease, but they don't talk about how women are impacted by living with HIV. They do not talk about that a lot. They lump it into women's health.
Mm-hmm. Yeah.
They lump it into women's health, and under women's health, reproductive health, then sexual health.
Why do you feel there should be a distinction?
I don't think it should be a distinction. If, like I said in the clip you was watching earlier, if you're having sex and if you're going to the doctor, have these conversations not only with your OBGYN, but your primary care doctor as well. So it should be included in your whole health. Everybody should have some kind of, every provider that's a medical provider should have a conversation about their sexual health history with your client, regardless if it's your PCP or your OBGYN. I think that to be inclusive as a whole. But as to the type of care, that should be sectioned off.
So what message do you give to your daughter and your grandchildren now?
As to what my daughter, they've always heard me say, the book's before boys, but love yourself. Because if you love yourself, you won't put yourself in certain situations, or you will have the confidence to have certain conversations. I do tell them, carry your condoms. I am that mother. Yes, I am that mother. But my final message is, you don't walk around with that man's thing in your pocket all day. It is not the American Express card. You do leave home without it.
Auntie NikNik.
Okay,
I love it.
But the overall message is just telling them to love themselves more. Because if you love yourself, you will not be susceptible to as what my dad would call it, the sweet nothings being whispered in your ear.
Yeah, absolutely. So what message do you have for current providers, doctors? What do you have to say to them to work with Black women like you? Like, what do you have to say?
I would say, be comfortable. We are not all one thing. We're not monolithic one. There are different aspects of our lives. We are mothers. We are daughters. We are friends. But more so, we are human beings at the end of the day. And just put yourself in that person's shoes. And if you really understand how certain isms work and how they intersect with the treatment of Black women, I think that was starting to kick off right there. But being comfortable, being able to have those candid, hard conversations and be open. Because I appreciate my provider being open, being honest, and being able to giggle with them.
Yeah.
And I want to get more than 15 minutes. I want to get more than 15 minutes, even though I know this is the landscape of healthcare now, because it's more money driven and more bit profit driven now. But being able to access those services and be comfortable with yourself and asking those questions, but also educate yourself.
Absolutely.
Educate yourself on the issues that impact Black women. And I think starting from there and being comfortable, we can go a long way. And put right messaging, like materials, in the office. If you're gonna put flyers in there, make sure it represents all women that you serve.
And for the women who are in our local area, or even nationally, because I know you get around, where can they go for resources that to get help? Like, how did you get support when you were in that dark time?
Google helped me a lot. I'm not even gonna lie. This is one time I will say Google. I would say Google helped me a lot, and from there I was able to have the confidence to, because I've always been more of a, hey, how you doing? This is who I am. So being in those circles allowed me to meet other people, introduce myself, and but I said it started with Google. But you know, you can have the Detroit Health Department through the City of Detroit website. They have different resources for teens, like the I Decide program. Those helped a lot. Those can help asking your doctor where those resources may be. Sometimes people don't like to go out. So you have to utilize, Facebook groups, social Instagram groups, but primarily, as Mom and Son call it, Facebook is for the older people. So I was like, you didn't have to do that. But, the Facebook groups, that helped a lot because, as you're newly diagnosed, you have that isolation period where you don't want to be around nobody. And at this time, you just want to sit and observe and learn. And if you have that option, I think that works for a lot of people too.
Okay. And this is the last question.
Mm-hmm.
What does HIV is not a crime mean to you?
That encompasses a lot of things. But for me specifically, in regards to meaning that I am free from possible incrimination because of my status in having sex with someone, and they want to be malicious or say I didn't tell them, and as a result of that, I make people say I've signed off. Yes, I have disclosed my status. You are aware. So people have a checklist when I do have sex with them, but just to protect myself. But overall, it means these charges, HIV is not a crime. People cannot be charged if you're a sex worker. And particularly, if you're a sex worker and you're out here making ends meet, doing what you do, because we all have to survive. They can't, if they find out that person's diagnosis, they can't use that as an undermining charge. So that piece right there, because we can see it happening. And the SERO project wouldn't be out doing this if these wasn't possible cases that were already on the books. So I think HINAC and SERO project, I thank y'all for doing that particular piece right there. Because here it is, you have several people at the height of the epidemic, one person, young man, I think he's still in there. As of now, he's being about my age, 40-something years old. But because of the state's lack of education around that in the state of New York, he's been in there since he was 18 years old. Due to that HIV disclosure law and their archaic ways and how they view people at the, when these laws were created in the state of New York, how they view people living with HIV. So hopefully he would be released soon or given another new trial, or however it may be. He should not have been criminalized for his diagnosis.
What do you feel about the Michigan laws?
I would say, given that everything has worked out, I would say I love our state of Michigan. People like, you moved? No. Why? Because we are more progressive than some other states. I would say we have more to do with our laws, but where it's sitting at now, I think is a lot better than when it was when it first was first enacted. You know, and every state has, you know, has their work to do. But when you're speaking for Michigan, I can't say nothing bad about it. Just hope we pick up another representative that was just as active as the former representative that helped push some things through when it came to that.
Any final thoughts? Take your time.
Any
Take a drink of water if you need to.
Final thoughts. I will say, love yourself, educate yourself, get to know people living with HIV. We're fun, sexy, still can do what we do, but also take time to get involved civically all the way around. Go vote too.